Hey, good afternoon, everyone. I'd like to welcome everybody to our meeting today. We do have a couple of members of the board joining virtually, so we will do our best to carry on and deal with technology. Councillor Michelli is still having a little trouble logging in, but I'm sure he'll join us shortly. I'd like to remind everyone that our meetings are web streamed and televised, and would ask that you ensure your phones are on silent mode and keep your camera on and mute yourself when not speaking. And of course, remember to unmute yourself when speaking. If you're joining virtually, please use the Microsoft Teams raise hand feature icon to be called upon and remove it when you're finished speaking. With that, I call to order the June 7th, 2022 Board of Health meeting. And the first item is to deal with the agenda. Could I have a mover and seconder for a motion to approve today's agenda as presented? Councillor Taylor, or Board Member Taylor and Board Member Van Driesche, all in favor? That is carried. Are there any disclosures of pecuniary interest? Seeing none. We have no consent items, no closed session items. So number 6 on the agenda, or 6.1, Dr. Matthew Strauss, Medical Officer of Health, will provide us with an update. Dr. Strauss.
Thank you, Mr. Chair. It's very exciting to be here with all of you in person. First time. I suppose the problem with my update today is there's less and less to update you about, but which is good news. The 6th wave of COVID-19 in Ontario, which we talked about as having crested, I think, at our last meeting, has concluded. If you're able to pull up my slides, slide number 1, which I emailed to everyone this morning, shows, nope, we don't have the slides. Oh, okay. It'll come up eventually, but slide number 1 shows hospitalizations and ICU admissions in Ontario, which has remained in steep decline over the last month. Hospitalizations in Halton, Norfolk are also markedly down. At the time of my written report, we were at 1 hospitalization in the community. We are now down to, sorry, it's now at 2. I would remind everyone that provincially, over the last few months, the majority of COVID-19 hospitalizations in Ontario and likewise in our community have been not because of COVID. They've been folks who either came positive during a stay for some other reason or came to the hospital for some other reason or found to be incidentally positive. Likewise, the majority of deaths in COVID positive individuals over the last few months have not been due to COVID. So because we're a smaller health unit, I'm pleased to say that myself and my predecessors have been able to review every death in a COVID-19 positive individual that has occurred in our community. I continue that practice. The majority of deaths in COVID-19 positive individuals that I have reviewed for the last 3 to 4 months have not been due to COVID. Those deaths that have been due to COVID have generally occurred in individuals who are otherwise moribund and receiving palliative care. It is unlikely, by my lights, that we will see further waves of COVID-19 until the fall/winter. COVID-19 is receding as a matter of public health concern, both locally and worldwide. If you can see slide 2, please. These are COVID deaths per million people worldwide. You will see that, thankfully, mercifully, this graph has collapsed worldwide. So we're now seeing worldwide fewer deaths on a daily basis than we have seen at any time during the pandemic since mid-March 2020. In short, this is a graph that defines a pandemic that is ending, is to say. When I say that the pandemic is ending, I by no means mean that COVID is ending. COVID will be with us, as far as I can tell, forever. Luckily, there are good treatments, there's good vaccines, there's building up natural immunity. I do not expect we will ever see our healthcare system put under the kind of strain by COVID that we have seen over the last 2 years. Of increasing public health concern have been other communicable diseases. So we have been monitoring reports of avian flu, of severe acute hepatitis in children, of monkeypox and pertussis. We are now up to, I believe, 5 confirmed cases of monkeypox in Ontario, something on the order of 18 suspect cases. There has been 1 swab performed for monkeypox in our community. Mercifully, that swab was reported as negative. So there have not been any cases in our community. Preponderance of the cases and suspect cases are in Toronto provincially. There was one case of pertussis in our community. That was about a month ago. I was very concerned about it because there are pockets in our jurisdiction that are relatively under-vaccinated for childhood diseases. And pertussis is in fact classically thought to be much more communicable than COVID-19, and it's a miserable, miserable disease when you get it. Luckily, that seems to have been self-limited, so we a little bit dodged a bullet there. All of that to say, we're actively monitoring these matters, and they are taking up more of my concern than COVID-19 at this part. And I'm excited to say that my counterpart, the Public Health Director, Dr. Shaw, is here to present our annual service plan.
Tom,
I've not
Shelley
is now joining.
I'm not sure. Sorry, I have not reviewed everything that he'll be presented today, but I hope that I guess I would want to underscore when considering his presentation that there is so much of public health that has been put on hold for 2 years. There is such a backlog. We've discussed this at other Board of Health meetings, that children aren't having their teeth cleaned the way we have in the past. Our classic vaccine preventable disease programs in schools have not been underway because everything has been seconded to COVID-19. So there is tremendous need to catch up with the backlog. And that's certainly the lens with which I will be listening to this presentation today. As always, Mr. Chair, I am happy to take any questions from the board members through you.
Okay, thank you very much, Dr. Strauss. Any questions from the board members for the acting medical officer of health? Or board member Huffman?
This is what you miss when you're here live. We have these fun microphones. Thank you, Chair Van Passen. Through you to Dr. Strauss. I just wanted to pick up on an item that we discussed the other day. Social Services Advisory Committee. I'd made a note of it, and I just wanted to follow through and see what we can do as a Board of Health. There was a question posed to you by Councillor Corbett regarding the lack of doctors in our rural community. How can we move forward as a Board of Health in terms of advocacy and trying to get some more doctors into our community?
Thank you for the question through the board chair, Board Member Huffman. So my answer to Councillor Corbett at that committee meeting was it's a monumental problem. It has been a problem since I was a medical student in 2004. When I was a medical student in 2004, there were programs designed to entice me to family practice in a rural community, which were plus or minus successful, I suppose. And I don't see that on a provincial level, that same energy still exists to try to attract folks to these sorts of practice locations. I think that it's something that requires a lot of attention, and it requires a lot of engagement with stakeholders. So I am not, as the acting MOH, able to kind of wave a magic wand and say this is the program. I invited the committee members at that meeting to contact me. Perhaps we could strike a working group. We would need to involve family physicians who are currently here. We need to involve educational institutions that surround us, like McMaster and Western. We need to involve provincial representatives like the MVP and the Ministry of Health. It would be a real whole of community effort to attract folks, and the deficit is really, really marked. I can't recall the percentage by which we lag the per capita average for the province, but it's more than 50%. We could double the number of doctors here to be as well served as the rest of the province. So I would really welcome being a part of such a working group. I'd be happy to lead such a working group I suppose the answer is partly political. Will require my colleagues in clinical medicine across the community, but will also require political efforts at all levels.
Thank you very much for that answer. So based on that, in terms of a working group, where would we go from there in terms of trying to form a working group? Does anyone have any answers to that?
I think that we could ask the clerk or someone to put that as an agenda item at an upcoming meeting and have staff bring a report on, which direction we can go and how best to do it. But I think that would be the proper process, Madam Clerk.
Oh, I'm sorry.
Through the chair to the board. So to put a motion on the floor, if you are looking for staff to come back to the Board of Health, that would be appropriate. If you're looking for it to be recommended to council, then you would make a recommendation to council to direct their staff to do that. Although you are the same entity, you are two different boards, so we just need to make sure who we're directing and who's doing that directing.
I think it is a Haldeman and Norfolk problem. So could we leave that till the end of the questions with Dr. Strauss, and you could bring forth a motion at that time, Councillor?
Yep, that sounds great. Thank you.
Great, thank you. Any more questions for the Dr. Strauss? Seeing none, you're letting them off easy. Shows up in person and so if there's no further questions, could I have a motion to receive the presentation as information? Board Member Taylor, Board Member Columbus, all in favor? That is carried. Thank you very much, Dr. Strauss. And Board Member Huffman, you would like to put forth a motion regarding the lack of medical doctors?
Yes, I would. I'm thinking in terms of that it would be something Board of Health related so that we can keep it, like you mentioned, Chair Van Passen, that it's a Haldeman Norfolk initiative. So I think it should stay within the Board of Health. And Dr. Strauss is already committed to being a part of that group. So my motion would read that we convene a working group to apply political, geez, I don't want to say pressure. You can help me wordsmith it, Teresa.
I'd like to develop a recruitment plan for
Or advocacy, maybe I think a little bit stronger than advocacy, actually. So what did you say there, Chris? Sorry, Van Passen.
Right.
No, I'm calling you by your last name.
that we try to develop or that staff bring back a plan to develop a recruitment plan to increase the number of doctors for Haldeman and Norfolk.
Okay, and I think that this is something that would involve the Board of Health, the acting medical officer of health, and definitely looking at involving we have a newly elected MPP, so I'm sure she's very interested in getting hitting the ground running. So that would be a good place to start. And then now I saw Heidi on the screen. It would also, I guess, involve the acting general manager of health and social services. And Heidi, you can pipe in as to who else would be an appropriate member of this committee.
Thank you, Board Member Huffman, through you to the board, or through the chair to the board. I would suggest that staff could bring back a report through advisory committee to the Board of Health with a suggested membership group for the working committee, for the working group. I would also include our family health teams representing primary care, and there may be others that our health unit team would suggest, but if you could leave that with us to bring back a report that would give you our suggested membership and actions that we would propose the working group undertake to increase physician recruitment, we'd be happy to do that. And we'll certainly have Dr. Strauss participate in the drafting of the report for you.
Thank you, Heidi.
I'll ask Madam Clerk, have you captured that in some fancy wording that you're so good at?
So through the chair, perhaps that the Board of Health direct staff to investigate the creation of a working group to develop a recruitment plan to increase the number of doctors within the Haldeman Norfolk Health District, and further bring back a report to a future meeting to review the project scope.
That's exactly what I heard our board member Huffman say, that, yeah. Our board member Columbus.
Thank you, Mr. Chair. And this doctor shortage has been an ongoing issue as long as I can remember. And the last time council dealt with it, perhaps 10, 15 years ago, we actually partnered with Norfolk General Hospital. They were involved in the process. So I would suggest that we include somebody from that organization, and perhaps Dunville Hospital and Hagersville Hospital.
I'm sure staff have noted your comments, and they'll develop a proposed group of members to deal with that. So, Board Member Taylor seconds. Any more discussion on the motion? All in favor? That is carried. Next item on the agenda is the minutes of the regular meeting, May 3rd, 2022. Unless there are any errors or omissions, I have a motion to approve the minutes as presented. Board Member Rabbits, Member Taylor, all in favor? That is carried. There's no communications. First one is 9.1 on the agenda, the vector-borne disease program update for 2021-2022, HSS 22-017. And Ms. Van Dyke, you're going to introduce the report.
Mr. Chair, I would like to introduce to the Board of Health Alexis Winveen. Alexis is the program manager for the environmental health team. She's going to be presenting the report today, and Mr. Syed Shah is with you in person to assist with any questions.
Okay, thank you, Heidi. And the room is all yours to
Tom Michelle
Is now exiting.
Thank you very much. Good afternoon. Through the chair to the members of the Board of Health, I will be presenting the Vector-Borne Disease Program Update for 2021 and 2022, HSS 22-017. The Haldeman Norfolk Health Unit asks that this report be received as information and that the Board of Health supports the Haldeman Norfolk Health Unit's vector-borne activities, including active surveillance and education for prevention strategies. Vector-borne diseases are human illnesses that are caused by bacteria, viruses, and parasites. These illnesses or infections are transmitted to humans by vectors such as mosquitoes, ticks, flies, sandflies, and fleas. Mosquitoes are known to be responsible for transmitting the majority of vector-borne diseases. The Haldeman Norfolk Health Unit's comprehensive vector-borne disease program is in place to monitor local tick and mosquito populations for diseases such as Lyme disease, West Nile virus, and Eastern equine encephalitis. This report highlights the public health initiatives that encourage the public to take preventative measures against tick and mosquito bites. Furthermore, there is a discussion of vector-borne disease program activities in the previous year and an overview of plans for 2022. Lyme disease is an infectious disease caused by the Borrelia bacterium that is transmitted to humans by the bites of infected deer ticks. The most common sign of infection is a bullseye rash on the skin. In 2021, tick dragging did not occur due to unprecedented staffing and logistical pressures due to the ongoing COVID-19 pandemic. There were 26 cases of Lyme disease in Haldeman Norfolk Health Unit compared to 7 in 2020. Of note, 24 of the 26 cases were in Norfolk. Cases across Ontario are rising from 809 in 2020 to 1,597 in 2021. Warmer temperatures are thought to be responsible to increase the incidence of Lyme disease through increased tick maturation rates and a longer available season of transmission. West Nile virus is a virus mainly transmitted to people through the bite of an infected mosquito. Mosquitoes transmit the virus after feeding on the blood of birds that carry the virus. In Haldeman, Norfolk, there were 121 pools of mosquitoes tested for West Nile virus in 2021. None of those mosquitoes tested positive for West Nile virus. Similarly, there were no West Nile virus positive mosquito pools identified in the Haldimand Norfolk Health Unit for the year 2020. In Haldimand Norfolk, there were no cases of West Nile virus identified in 2021. There were also no cases identified in 2020 and only one case in 2019. In 2021, there were 23 reported human cases of West Nile virus in Ontario compared to 77 in 2020. Eastern equine encephalitis, also known as sleeping sickness, is a disease that is spread to humans and horses by mosquitoes. In Haldimand, Norfolk, no human or equine cases of Eastern equine encephalitis were identified in 2021, which was also the case in 2020 and 2019. Provincially, there was only one case of Eastern equine encephalitis identified. Like West Nile virus, Eastern equine encephalitis is influenced by temperature and precipitation. Therefore, activity will vary yearly. Additionally, there is a vaccine available for the equine population, influencing the number of equine cases reported each year. Plans for 2022 include efforts to increase public awareness about vector-borne diseases. The environmental health team will be working with the communications department to ensure the delivery of educational messaging through radio, social media, newspapers, and the Haldimand Norfolk Health Unit website and smart TV ads. We will develop promotional campaigns to raise awareness and build supportive environments to prevent and mitigate mosquito bite exposures. The Haldimand Norfolk Health Unit is also working with the county's Parks Department to ensure availability of tick warning signs in tick-prone areas, as well as regular communications to local hospital and physicians to increase awareness of the potential for Lyme disease infection in our area. In conclusion, the vector-borne program will focus public health services required to protect the health of the community. The key is education of the community with the goal of minimizing the likelihood of exposure to mosquito and tick bites. Thank you very much, and I would like to open this for discussion. Thank you.
Okay, thank you, Alexis. Is there any questions from board? Board Member Martin.
Thank you, Mr. Chair. Through you to Alexis. So I see in the report that we will resume tick dragging this year. And just, I believe if you could confirm to remind me, this is just a random selection of areas that we drag to test. Is that correct?
Thank you. Through the chair to board member Martin. Actually, this year what we've done is we've focused on a corridor from approximately Port Dover up to Cayuga that we have not had previously identified as a Lyme disease risk area. We know that the other areas in both Haldimand and Norfolk have been identified as such, so we wanted to make sure that we focused on areas that were not previously identified.
Okay, thank you very much. And so my only question then, I guess also intended for the public record. Typically in previous years, there's been a variety of different roles that the health unit has played specifically with vector-borne disease, but specifically with ticks and Lyme disease. And previously people have been able to take a tick that they have found latched onto them to the health unit for testing. Are you able to clarify here today what the role of the health unit will be in that particular situation and what the public should do if that occurs?
Absolutely. Through the chair to board member Martin. So the health unit can respond to inquiries from the public regarding ticks. There is also a tick identifying chart that is available from the Ontario website as well. And also advice on where to turn to if they are suspecting that they have been bitten by a tick, such as contacting the family doctor or family health teams to ensure that there is proper follow-up.
Okay, thank you. So just to clarify specifically, please do not bring your ticks to the health unit.
That is correct. Thank you.
Seems you got the special feedback mic today. Right? Board Member Columbus, you had a question?
Yes, thank you, Mr. Chair. Very good report, Alexis. And my question, perhaps you may not be able to answer it. I don't know. Might need some help. It's about the vector disease program the amount of dollars that we spend on that particular program in 2022 year? What was the budget for it? I think we did not spend all the money last year. Go ahead.
Through the chair to Member Columbus, the amount of dollars is actually encompassed within our health unit budget. There's no specific budget for these specific programs. It's staff that need to go out on their assigned days to address these issues and do the tick dragging. We also have the West Nile mosquito virus program, and we have mosquito trapping done through a company called Canned Green, who does the mosquito trapping for us. I would have to defer to Michael Vansicle for any specifics regarding the budget for it, but it is included within our whole entire health unit budget for the environmental health team program.
I guess the important part is, does the province cover 100%?
I would have to defer to Michael Vansicle for that question.
Thank you.
Thank you.
Now, Mr. Van Sickler, can we put you on the spot, please?
Through the chair to the board, Alexis has it right there that we have the entire environmental health team program, which we budget for. And within that budget, we have separated programs. They're all rolled up into the environmental health team. And to answer Councillor Columbus's question, we no longer receive 100% funds for this program. It's all rolled up into the mandatory programs, which is 70-30 cost shared.
Got the answer. Thank you.
Yeah, I did ask a similar question at the committee meeting about, you know, when you read the report and ticks are endemic to Haldeman, Norfolk, mosquitoes are endemic, why are we wasting resources catching them and trapping them? And we should be applying those resources to better communications, get the public a better understanding what to do when you have a tick on you or when you get stung by that mosquito, and you know, develop better protocols with our doctors on how to treat those things. But the province says we have to do the actual trapping on the ground, and so we follow their rules. I don't know if you'd like to add anything to that, Alexis, or because I know I brought it up the other day and I was given an answer, but if you'd like to add to that, please.
Absolutely. So yes, it is something that we are required to do, but there's also a benefit in surveillance as well to see if any trends are changing from year to year. For example, you know, Lyme disease has increased in year 2021 compared to 2020 and 2019. And we know that weather is affecting the West Nile virus as well as Lyme disease due to the environment. So it's good to do some risk analysis as well to see if our mosquito control programs are working, as well just to see what's in our area.
Or it could have been just because of all the lockdowns, people actually went and took a walk somewhere, got some fresh air, and it's got nothing to do with the number of ticks out there. There's that people found them. Any other questions for the staff? Seeing none, there is a recommendation that staff report HSS 22-017 vector-borne disease program update 2021-2022 be received as information, and that the Board of Health supports the Haldeman Norfolk Health Unit's vector-borne program activities, which include active surveillance and education regarding the prevention strategies for vector-borne diseases. Would there be a mover for that? Board Member Martin, seconded by Board Member Van Andrieschie. Any discussion? All in favor? That is carried. Thank you very much, Ms. Winveen. Next item, 9.2, the Safe Voluntary Isolation Sites Program, HSS 22-018. And Ms. Van Dyke, you'd like to introduce this report as well?
Yes, thank you, Mr. Chair. Ms. Winveen is also going to present this report on behalf of the environmental health team.
Okay, thank you.
Thank you very much. Through the chair to the members of the Board of Health, I will be presenting the Safe Voluntary Isolation Sites Program Report, HSS 22-018, and that it be received as information and that the Board of Health supports and approves the Haldimand Norfolk Health Unit's application to the Public Health Agency of Canada for the Safe Voluntary Isolation Sites Program. The Safe Voluntary Isolation Sites Program that is offered by the Public Health Agency of Canada aims to decrease community transmission of COVID-19 by providing funding for projects that address gaps identified for individuals who are unable to safely isolate due to housing conditions such as international agricultural workers. COVID-19 continues to be a disease of public health significance in 2022. The Government of Canada is focused on efforts to delay and slow the spread of this disease and address underlying issues faced by vulnerable populations at higher risk of transmission. The Safe Voluntary Isolation Sites Program, the SVISP, is an initiative that the Public Health Agency of Canada, PHAC, has established and will complement other investments in health measures by addressing gaps within the existing isolation support infrastructure. The Government of Canada has identified $100 million for the SVISP as part of the efforts addressed to address COVID-19 pandemic. The Haldimand Norfolk Health Unit has an opportunity to apply for funding from PHAC for the SVISP program that would be of benefit to international agricultural workers, farmers, in both counties of Haldimand and Norfolk. The Haldimand Norfolk Health Unit would like to apply for this funding opportunity. This initiative would support farmers and international agricultural workers by providing a funded, safe isolation space that would not be a financial burden to our community farmers and would help mitigate the spread of COVID-19 at farms and in our community. In the past, farmers were able to apply for funding directly from PHAC to receive reimbursement, but going forward, this option is not available. Through the SVISP program, operators with farms in outbreak situations will be invited to collaborate with the Haldimand Norfolk Health Unit to provide international agricultural workers a designated safe space at no cost to the farmer through a reimbursement model. The Public Health Agency of Canada agrees to have quarterly reviews of funding to meet the needs of the communities of Haldimand and Norfolk. In conclusion, the Safe Voluntary Isolation Sites Program will focus public health services required to protect the health of international agricultural workers and our community. The key is to provide safe isolation space for international workers who are at high risk of transmitting COVID-19 due to housing conditions, as well as supporting our farming community. Thank you.
Okay, thanks very much, Alexis. Remember Columbus, I'm sure that you could throw the support of the Ag Advisory Board behind one of these or this type of program.
For sure, Mr. Chair, I think this is a very good program coming. Too bad it wasn't in place for the last 2 years.
And Board Member Van Andrieche, you had a question?
Yeah, thank you, Mr. Chair. Whereabouts would be considering housing these people if there was an outbreak that you'd have to find appropriate housing? If we're taking it off the farm now, this is the way I'm interpreting this?
Thank you. Through the chair to board member Van Andrieche, we are going to be teaming up with local hotels in both Haldimand and Norfolk counties in spaces that would be convenient for the farmers.
Spaces which would be convenient for the farmers in what sense?
So for example, so for example, if there was an outbreak happening at a Haldimand farm, then the farmer would be able to choose the hotel that would be most convenient for them and closest to their farm so that they would have better access to their international agricultural workers.
And when did the term change from foreign agricultural worker to international?
Just recently.
Exactly. Okay.
Yeah.
I wondered because it's never been in my vocabulary.
No, when we were invited to apply for this funding opportunity, that was the terminology that was used within the application and what they used within their correspondence with the health unit.
Thank you.
I have Member Rabbits followed by Member Martin.
Thank you, through you. I had a similar question to my colleague sitting beside me here about the location. So we've answered that one, but I wanted to also ask about language barriers and translation services. Have any of those barriers been contemplated in this program? How would we offer, say, a Spanish speaker or someone that spoke a Caribbean dialect, considering the populations that we serve?
Thank you. Through the chair to Board Member Rabbits. When we are dealing with outbreak situations at the Haldeman Norfolk Health Unit in regards to farms, Norfolk County actually uses the translation services that our staff members would be able to do health checks through a translator with our public health nurses as well as our public health inspectors.
Thank you. Member Martin.
Thank you, Mr. Chair. Through you to Alexis, my question about this, I fully support this motion here today and hope that we're successful in some funding. My question would be the actual program itself, if we are successful and it comes to Haldeman Norfolk, is the programming and how that is run, is that up to each individual municipality? Will we be running a different program than, say, Oxford or Brant? What are the parameters around successful funding?
Thank you. Through the chair to you, Board Member Martin. So there are varying ways that we could run this program. The BC model is a reimbursement model where the farmers would actually pay up front for the isolation space as well as the food for their international agricultural workers and then reimburse the farmer that way. In Niagara and Windsor, which is other programs that we have looked into as well. There is a different model where we would secure spaces regardless of whether or not we have people who are affected by COVID-19. So there are a couple different ways that we can approach this, and it is left up to each municipality or organization.
Okay, thank you. Any more questions? Seeing none, there's a recommendation that staff report HSS 22-018 Safe Voluntary Isolation Sites Program be received as information, and that Board of Health supports and approves the Haldeman Norfolk Health Unit's application to the Public Health Agency of Canada for the Safe Voluntary Isolation Sites Program. Your mover, Member Columbus, seconded by Member Taylor. Any discussion? All in favor? That is carried. Thank you, Alexis.
Thank you.
We move on to item number 9.3. The Haldeman Norfolk Health Unit Funding and Accountability Agreement Budget Amendment Report HSS 22-022. And Ms. Van Dyke, would you like to introduce the report?
Yes, thank you, Mr. Chair. Mr. Shaw is with you in person today to present this report, and our financial analyst, Michael Vansicle, is also with us on the line to assist with any questions.
Okay, thank you, Heidi.
Thank you and good afternoon. To the chair, to the members of Board of Health, I'll be presenting 2022 Budget Amendment Report on Health Unit's Annual Service Funding and Accountability Agreement. This report is to advise Board of Health on the outcome of Annual Service Plan submission. The Annual Service Plan was submitted to Ministry of Health on 1st of April 2022 and presented to Board of Health on 5th of April for endorsement. Now Ministry of Health has communicated the approved allocations through the funding agreement on 2nd of May. So I'll be focusing my presentation on 4 important sections of this report. The first one is base funding. The second one is one-time programs funding. The third one is budget amendment summary. And the fourth one is FD impacts. So I'll start with base funding. So for base funding programs, in annual service plan request, we asked for $6.07 million and ministry approved allocation of $6.223 million with a variance of $149,000, out of which $54,000 is for mandatory programs and $95,000 is for Ontario Seniors Dental Care Program. So this $54,000 will be utilized to offset the levy contribution, and the increase of $95,000 for Ontario Seniors Dental Care Program, that will be used to offset the eligible costs within that program. The next one is one-time programs. So 8 one-time funding requests were submitted. 4 of them, they were approved and allocated funding, and they are COVID-19 general program, COVID-19 vaccine program, PHI student practicum, and smoke-free Ontario tablets. Additionally, 2 requests from the previous year were extended, and they are cost sharing mitigation and school focused nurses initiative. There were another 2 requests that were carried over where funds they were not fully utilized in previous years. So the first one is strategic option analysis, and the second one is Ontario Seniors Dental Care Program capital. Interestingly, there are 2 new allocations which were not part of ASP requests. The one is needle exchange program, and the second one is temporary retention incentives for nurses. For needle exchange program, we'll be planning to use this amount of $19,000 for installing safe and secure sharp disposal units at some designated places. The second one, which is a temporary retention incentive for nurses, so that's a new incentive by the Ontario government to temporarily support nursing retention and stabilize the current nursing workforce during this critical time. So an amount of $5,000 at the most will be provided to eligible nurses. There are 4 one-time funding requests which were not approved, and they are part of table 4. The third important thing which I want to discuss is a budget amendment summary. So in total, the approved budget was around $8.277 million. And now the approved allocation from Ministry of Health is $10.458 million with a variance of $2.181 million. So this is the amount we'll be requesting to be part of budget amendment. The fourth thing is FTE impacts. So program FTE impacts have been included in table 6. So unless the Ministry of Health provides communications that programs will be extended, all one-time programs included in this table will be ending December 31st, 2022. With this, thank you so very much, and I'm happy to answer any questions.
Okay, thank you, Syed. Any questions from the board member for Mr. Shaw or Mr. Van Sickle? Member Rabbits.
Thank you, and through you. My questions are about the programs that were not approved. Specifically in table 4, the first 2 services are quite concerning, and it outlines that there may be an opportunity for specific in-year requests to be made. Our staff anticipating that we'll have, in a response to the programs that were not approved, a specific in-year request at any juncture in time. And I also have a follow-up question regarding the non-violent crisis intervention training. Are we typically having funding for training coming through our annual service plan, or how would we otherwise normally be funding training like that for our staff?
Thank you. Through the chair to board member Rabbit. So you are right, like ministry didn't give us any rationale why they didn't approve that funding, but they did mention in their meeting that down the line there would be an opportunity for the health unit to discuss all these requests which were not approved. And going back to your specific question about the first 2 initiatives, So we do have a plan for the first one, that's a mental health and addiction services. So we propose to have a pilot project with social services, specifically with the homeless prevention program, where we ask for a public health nurse to support those populations in terms of like counseling, referral, and emergency management. So we do have within house the social determinant of health nurses, which we are planning to utilize for this purpose. And for second one, we don't have any in-house resources to tackle this issue. And going back to your third question for you are very much right. It's non-violent crisis management training. So overall, training is a part of our funding from the ministry. That is a split between ministry and municipality, 70-30. So if I remember correctly, like $400 per staff is allocated as part of our training budget for every staff.
Okay, thank you. I have Member Vanendry.
Thank you, Mr. Chair, and through you. My questions were similar to those of my colleague associate accompanied here beside me here today. My concern is what happens with mental health. What type of services do we have now? Like, I mean, I know there's not sufficient funding here, but what do we have now? What happens now?
So through the chair to board member Nutrishi, we don't have a mental health program within our health unit at this point in time.
So say for instance, the scenario is, say for instance, you get a 911 call comes in to the county and you have to do a health check, and obviously the police go out with that. There is no one that accompanies, or there is no assistance for mental health. Like, what happens? Does that individual end up going to the hospital or the police take them to the hospital if they do a mental health check, or we don't even have that service?
Yeah, through the chair to board member, we don't have any mental health services within the health unit. So if someone is calling 911, it goes directly to EMS.
And what happens then? Like, is the process here? Because I'm a little concerned because times are changing. And I think I feel sad that we don't have that. I agree. It's just something that's lacking here. And I think we need room for improvement.
Through the chair, I'm going to refer this question to Heidi.
Thank you, Syed, and Mr. Chair, through you to Councillor Vanendrishi. Mr. Shaw is correct that if someone was to call 911 with a mental health emergency, they would receive first responders, either police or EMS, or perhaps a combination of both, and then would be taken to the hospital for assessment and would be referred to our community-based mental health agency partners, either such as the Canadian Mental Health Association or Community Addiction and Mental Health Services. Mr. Shaw is also correct that Health and Social Services does not provide clinical mental health services, meaning that we do not have registered social workers, psychologists, psychiatrists, or mental health clinicians on staff who provide treatment or assessment. We do have within the health unit public health nurses, as Syed said, who work in the social determinants of health program or who work in substance use and harm reduction. And within social services and housing, we have community support workers in Ontario Works and housing support workers in the homeless prevention program who would provide support to people who are experiencing mental health issues to get connected, to do some immediate crisis support, and then connection and facilitation to longer term services that are based in the community. The purpose of the pilot project that we had applied for which we had applied for dedicated funding, was to add a public health nurse to the homeless prevention services team, as Syed said, to provide those specific services to our clients, specifically in the emergency housing program. The intention was to have an integrated team between the health unit and social services and housing to support some of our most vulnerable clients in the emergency housing program. Without this funding, we will continue to use the services that we have already, and we will continue to refer out to our community-based partners. But we had requested to do this pilot project in order to explore further integration between the health unit and social services, and because we have recognized a gap in service.
Well, then I can appreciate that. There is a gap in services, and it appears to me that there is a need, and if we can continue to try to get funding, I think that would be very important. Because I do see a need. I really do. Thank you.
And Member Huffman, you have a follow-up on that subject?
Yes, thank you, Chair Van Passen. I just wanted to say that there is a component through our local OPP detachment that involves a mental health component. So there are with our collateral agencies opportunities for some of these issues to be addressed.
So if I get it right, the services are available. There are some gaps, and what we were applying for here was to try to fill those gaps. Is that correct, Ms. Van Dyke?
Yes, Mr. Chair, and also to approach our service delivery in a more integrated fashion between the health unit and social services.
Thank you. Member Martin.
Thanks, Mr. Chair. Through you to staff. I'm wondering if we can elaborate a little bit on specifically the COVID funding. We received much less than we requested. Is it safe to say it's kind of winding down, or how do we plan to continue to work on COVID, but also shift back to other priorities and recognize that we're receiving less funding from the government for COVID?
Thank you through Coach to Board Member Martin. I'm going to refer this question to our colleague Michael Mosquito.
Thank you, Syed. Through the chair. So we have received an initial cash flow from the ministry. They have still committed to funding all eligible COVID costs at 100%. And about the reduction in the program, as we see the requirements decrease for how many staff we are needing for the program, costs will decrease, and as things return to normal, our use of this funding will decrease as well. But just to put that point home, the ministry is committing to funding these costs, and the cash flow that you see there is just an initial allocation so that boards of health don't run into any cash flow issues.
Acceptable, Member Martin. Any further questions? Seeing none, there is a staff recommendation that staff report HSS 22-022, the Haldeman Norfolk Health Unit funding and accountability agreement be received as information, and that the approved 2022 Haldeman Norfolk Health Unit operating budget be amended to include $2,031,300 in base and one-time funding, and that the approved 2022 capital budget be amended to include $150,000 in one-time funding, and that the Board of Health endorse the delivery of the one-time programs as outlined in the report, and further that the Board of Health approves the extension of the COVID-19 program staff until December 31st, 2022. Anybody like to move that or propose an alternative? Moved by Member Taylor, seconded by Member Van Andrieschie. Any discussion? All in favor? That is carried. Okay, thank you, Syed and Michael. The next item, 9.4 on the agenda, the Ontario Seniors Dental Program overview and update to memo or report HSS 22-023. And Ms. Van Dyke, you would introduce this one as well?
Yes, thank you, Mr. Chair. This information memo has been prepared for the board in response to some questions that came up at the last Board of Health meeting. It is here for your information, and Mr. Shaw is present today to answer any questions that you might have about it.
Okay, thank you, Heidi. Any questions from the board? This memo? Seeing none, there's a recommendation that the information memo regarding the Ontario Seniors Dental Care Program be received with information. The mover, Member Taylor, second by Member Huffman. Any discussion? All in favor? That is carried. No bylaws today. Is there any notices of motion? Seeing none. No other business. We have a confirming bylaw. That bylaw 2022-08 BHB being a bylaw to confirm the proceedings of the Board of Health for the Haldeman Norfolk Health Unit at this regular Board of Health meeting held on the 7th of June 2022 be approved, signed by the chair and the board clerk and affixed with the corporate seal. Is there a mover and seconder? Moved by Member Rabbit, seconded by Member Columbus. All in favor? That is carried. And Councillor Huffman, would you like to propose a motion to adjourn? Moved, seconded by Member Taylor. All in favor? That is carried. Thank you very much, everyone.
Thanks, Chris.
Yes, thank you, Madam Chair.